1. Position for upper GI endoscopy. Supine with head elevated. 2. Position for enema. Sims position. 3. Drink milk from cup independently at 15 months. 4. Draws vertical line by 18 months. 5. Draws horizontal line by 2 years. 6. Draw diamond by 6 years. 7. Draw circle by 3 years. 8. Draw triangle by 5 years. 9. Draw cross and rectangle by 4 year. 10. Eat with spoon independently by 18 months. 11. Build tower of 6 blocks. 2 years. 12. Handedness established by 3 years. 13. Vocalization by 2 month. 14. Cooing by 3 month. 15. Babbling by 4 to 5 months. 16. Monosyllable by 6 months. 17. Bisyllable by 9 month. 18. Meaningful 2-word sentence. 1 year. 19. Jargon by 15 months. 20. 1 to 2 meaningful words. 1 year. 21. Tower of 3 blocks. 18 months. 22. Priority in surgical ward. Post-incisional pain. 23. 2 days after angio discomfort at catheter site. Assess for signs of infection. 24. Hypotonic contraction. Inform the doctor. 25. AFP is to detect NTD. 26. Time for AFP. 16 to 18 weeks. 27. Time for CDS. 11 to 13 weeks. 28. Precautions for bacterial meningitis. Droplet precautions. 29. During NTG to monitor BP. 30. DOC for Parkinson disease. Levodopa carbidopa. 31. Finding of ARDS. Decreased lung compliance. 32. Most common symptoms in hypothyroidism. Cold intolerance. 33. Type of needle used for suturing. 3/8 circle needle. 34. Normal CVP. 2 to 8 mm of mercury/8, 12 cmH2O. 35. Chromotropic. Increase heart rate. 36. Anemia in preg. Physiological anemia. 37. Epornithic. Disease in birds. 38. DIS transmits by vertical transmission. Hepatitis B. 39. Quantitative change. Growth. 40. Qualitative change. Development. 41. Growth and development more in infant and puberty. 42. Ovum/gamete. Ovulation to fertilization. 43. Zygote. 0 to 2 weeks. 44. Embryo. 2 to 8 weeks. 45. Fetus. 8 weeks to till birth. 46. Neonate. 0 to 28 days. 47. Early neonate. 0 to 7 days. 48. Late neonate. 8 to 28 days. 49. Infant. 29 days to 1 year. 50. Toddler. 1 to 3 years. 51. Preschooler. 3 to 6 years. 52. Schooler. 6 to 12 years. 53. Adolescent, ACC to who? 10 to 19 year. 54. Early adolescent. 12 to 14 years. 55. Middle adolescent. 14 to 16 years. 56. Late adolescent. 16 to 20 years. 57. Birth to 3 months. 110-160 beats/min. 58. 3 months, 2 years. 80 to 150/min. 59. BP for 0 to 7 years. 110 to 100/55-70 mmHg. 60. BP cuff size. 45 to 70%. 61. HB at birth. 17-24 gm/100 ml. 62. HB at 1 year. 13 to 17 gm/100. 63. Fetal HB is replaced by adult HB within 6 weeks. 64. Newborn lung capacity. 90 milliliters to 100 milliliters. 65. Specific gravity of urine in newborn. 1.001 to 1.020. 66. Specific gravity of urine in adult. 1.015 to 1.030. 67. Newborn passes urine within 24 hours. 68. Newborn passes feces within 48 hours. 69. Spoon-shaped nails. Koilonychia. 70. 90% brain development attained at 2 years. 71. Injectable polio vaccine. Salk killed. 72. Vit-K should be administered within 6 hours of birth but after 1 hour. 73. Umbilical cord contains 80 to 100 milliliters of blood. 74. Birth asphyxia. Not started respiration. 75. First sign of RDS. Dyspnea. 76. Late sign of RDS. Cyanosis. 77. Suction pressure of preterm newborn. 60 to 80 millimeters of mercury. 78. Suction pressure of term newborn and infant. 80 to 100 millimeters of mercury. 79. Suction pressure of child. 100 to 120 millimeters of mercury. 80. Suction pressure of adults. 120 to 150 millimeters of mercury. 81. BCG. Bacillus calmette-guerin. 82. Oral polio vaccine. Sabin live vaccine. 83. Birth vaccine. BCG, OPV, and Hep B. 84. Vaccine first given at birth. Hep B. 85. First assessment of newborn. Respiration. 86. Insuction. First mouth F/B nose. 87. Parkinson disease is due to decreased dopamine. 88. GDM mother prone to have macrosomia baby. 89. Position after liver biopsy. Right lateral position. 90. Position during liver biopsy. Supine and left lateral position. 91. Serology test for typhoid. Weidel test. 92. IOC for typhoid. Blood culture. 93. Gold standard test for typhoid. Bone marrow. 94. Dust size responsible for pneumoconiosis. 5 micron. 95. Snowstorm appearance is seen in silicosis, hyadidiform mole. 96. Frostbite lead to gangrene. 97. Bisonosis. Cotton dust. 98. Wells disinfection. Chlorination. 99. Residual chlorine level in drinking water. 0.5 mg per liter. 100. In orthotolidine test color change is due to free and combined chlorine. 101. Most common complications of measles. Otitis media. 102. Fatal complications of measles. Pneumonia. 103. Incidence. New case. 104. Prevalence. New plus old cases. 105. Koplik spot is seen in prodromal stage in measles. 106. First identified case. Index case. 107. Acute bloody diarrhea. Dysentery. 108. Rhizomal is for severely malnourished child. 109. Osmolarity of rhizomal. 245 mol/L. 110. Cholera is also known as Blue Death. 111. Incubation period of hepatitis B. 45 to 180 days. 112. Normal conversation rate. 60 to 65 dB. 113. Housefly transmits poliomyelitis. 114. Louse transmits epidemic typhus. 115. Itch mite. Scabies. 116. Passonopian. National Nutrition Mission. 117. Basic unit of life. Cell. 118. Basic unit or building blocks of living organisms. Cells. 119. Physical basis of life. Cells. 120. Prokaryotic cells. Lacks true nucleus. 121. Eukaryotic cells. Has true nucleus. 122. Not assimilated by eukaryotic cells. Nitrogen. 123. Powerhouse of cells. Mitochondria. 124. Oxidative metabolism is responsible of. Mitochondria. 125. Aerobic respiration performed by. Mitochondria.